All right, welcome everyone to this evening's personal statement workshop. I'm Dr. Amanda Dye from Beyond Barnard and very excited to talk with everyone this evening about how I think you can get started with thinking about your personal statements. We're going to jump right in. So my goals today are really for us to talk a little bit about why personal statements are part of health professions applications processes, why they're challenging to write in pretty much every case. I'll walk you through a couple of exercises that I encourage folks to use to practice generating ideas if you're having trouble getting started. And then we'll talk through some tips about how to present yourself and your experiences effectively in the various parts of your application, as well as some overall tips that I have for personal statement writing. So we'll get started with some basics. We'll talk through a couple of writing exercises. In this virtual format, it's a little tough to actually do the exercises, so we're just going to briefly talk through them, and I'm going to share the slides with you so that you can get into them yourselves later. We'll talk about using the various spaces in the application effectively, and then some tips and techniques for bringing your personal statement from an idea into a fully realized essay. So to get started with the basics, I want to talk a little bit about why these things are part of application processes. The personal essay, the personal statement is a way to express a little bit more of your own individual perspective. So in contrast to something like a list of activities, the personal statement is really about expressing who you are versus the things that you have done. A personal essay is also a place where you can convey, like your level of depth, maturity, the things that you've learned over the course of your life. It's also a place where you can highlight things that are particularly important to you as related to your prospective career, and potentially a place to express some of your personality, to kind of give readers insight into the person who's behind the words. A personal statement is an opportunity to share that individual perspective. It's also an argument in favor of accepting you to the program type that you are interested in joining. And it's a professional communication, meaning it's something that you do have to work on, something that you do have to take through many layers of revision, but it also is a document that can convey your personality, your personhood. A personal statement is not a complete autobiography. It's just not possible in the space that you have. Dental and medical school applications will give you between 4,500 and 5,300 characters, including spaces, to write a personal statement, and that is not a lot of space. So the first thing I always encourage people to remember is that a personal statement is never going to be exhaustive, so don't attempt that because it's just a waste of time. A personal statement is also not a prose form CV or resume. Application services for health professions programs will ask you to provide a lot of details about your experiences, and those are things that do not have to be replicated in the personal statement. Now, a personal statement might involve reference to particular activities that you've pursued, but the wording is not going to be the same as in, for example, your activity section. A personal statement is also not typically a place to explain things that didn't go as planned. I think it's much more helpful to think of a personal statement as, an opportunity to communicate something real and true about yourself, and something that you would want admissions officers to take away. It's also not a formality, but it is really hard. So, some challenges that come with writing personal statements are that it's a really uncomfortable process. It can be very vulnerable to write about yourself, to tell your own story, especially when you don't know the people who are going to be reading it. You don't really know how this statement is going to be received. It takes a lot of time. It's an effort intensive process for most people, especially in the first iterations of these statements that they make. It can be really difficult to decide exactly what you want to focus on, and we'll talk about that with respect to the exercises that I share. There is a lot of variability in terms of who's going to be reading your application, and maybe what will resound with one person that won't with another. So it's, sort of impossible to fully anticipate exactly, all of the reactions. I think also Many of us are people who really want to submit things that are absolutely the best that they possibly can be. And that desire to kind of, produce something that's as close to perfect as possible can be really debilitating with respect to a personal statement because it is by nature something incomplete. It's, as I said, never a total history of someone's life or their feelings or values. And so there's always going to be some element of incompleteness and a sense of like imperfection from that perspective. The subjectivity, of course, like you might think that something is important and another person might disagree. You might react to your friend's personal statements in different ways than they react to yours. And it can be really challenging to move from, your internal experiences of, whatever has drawn you toward a career in the health professions and putting those things into words. I think that it definitely is a delicate balance, and it can take a lot of time and a lot of trial and error to find the right way to express what you want to express in as succinct a form as you need to for these applications. So things that you should keep in mind for creating a strong personal statement is typically there is some sense of narrative, right? You're drawing the reader forward with you through this page or so of writing. So it's not a long narrative by any stretch of the imagination, but you want to make sure that everything is building on what's come before. Also, good personal statements are honest. They say something true about the candidate, and they also express a well-defined perspective. It's important that when you write a personal statement, you read it and you think to yourself, really nobody but me could have written this. Not necessarily because the experiences that you're writing about are so far from other human beings' experiences, but because you have so accurately expressed your own internal human reactions to those experiences, which are unique to you. It's a polished document. It's something you've revised a lot, and we'll talk about that in my next workshop in February. And of course, a personal statement is really intended to make the reader want to talk to you in person. The goal is that someone reads this and says, hey, this person is interesting. Their experiences really align with what we're looking for. Let's interview this person. So where do you start? There's no magic. You start writing. And the exercises that I'm going to share with you are ways to start generating pieces of writing. But ultimately, any way that you can get started putting things on the page is the most important step. It is easier to revise than it is to write from scratch, for sure. So once you have something as a base, your task gets easier and easier with every iteration. When you start writing, and you're really not editing yourself, you're just kind of putting things down as they come to you. A lot of it may not be like good, may not be stuff that you actually end up wanting to use, and that is fine. Nobody cares. Nobody but you is really going to see the evolution of this piece of writing. You should keep going. And as you start to think through what you're writing, it's going to, you're going to start to filter those things and find places where you really like the way something sounds in the written language and things that you might want to pursue further. Also, it's important to write when you write and edit when you edit, censoring yourself during the sort of more creative and brainstorming parts of the process. It's just usually a distraction. I think it makes things take longer. So when you're in a state of really trying to just like start generating material, try as best you can to hold yourself back from questions and doubts and things like that. You can get rid of anything that you want to get rid of later, but the more you can generate ideas quickly and kind of productively, the better. So with that in mind, I want to talk you all through a couple of different exercises that I think are really, really helpful for getting started. And these are definitely not the only ways, but if you're feeling a little bit stuck, you're feeling a little bit unsure, these are definitely two things that I do recommend. So the first of them is an exercise that I call gathering images. And the idea here is that you just start kind of listing out, sentences or bullet points or fragments of sentences, anything that comes to your mind, any images, from your past that has to do with your interest in science or your intended profession. So these could be experiences that you've had in college or earlier. It could be things related to, things that you have accomplished, but it also could be things related to things you have experienced passively. And this first step is really just about generating a list of anything that you can think of from your past that is potentially relevant here. You don't have to do a ton of filling out the details, just enough to kind of, keep it in your mind. This thing is relevant. So my examples here, these are all things that are true of me. And when I was in college, I was planning to apply to a PhD program in linguistics. The personal statement there is a little bit different. But if I were writing a health profession style personal statement as someone preparing for a PhD, I would think about all of these different things, right? So some of them are academic, things that I really, really enjoyed studying. Some of them have to do with research that I conducted as an undergraduate. Some of them have to do with my like social background, where I come from. And the last one has to do with like me being a weird little person and, the things that I liked doing, the things that I was naturally attracted to as a child, right? And so once you build up a list of these things, the next thing that you do is, take the first item for your list and for about 5 minutes, just free write about it. Start to develop it a little bit more. And then when you finish those 5 minutes, step back and think about, how well does this convey something real, something, personal to me? Does the reader get a sense of my motivations and my goals within my professional path from reading about this experience? And how well does it express your readiness to begin your professional training? And you may find that, individual images might not address all of them, but a combination of a couple of them could do the trick. And that could be a place to start looking for stories that you might want to tell. You could also think about the ways that, potentially a story about yourself could relate more to the way you've spent your time more recently as a college student or college graduate, and think about how those things could connect in a personal statement. So you do this again and again, and just keep going with all of the items on your list. It's really, really important not to just work with ideas, but to work with the actual writing. Here is, a piece of writing is impossible to evaluate until it's actually written, right? So lots of ideas could feel true and good, but you may find that they just don't lend themselves well to the format of the personal statement. The only way to really find that out is to try it. And I think an exercise like this is a way that allows you to not necessarily commit to, I'm going to write a personal statement about this, right? You're only writing for 5 minutes about each of these things, but also to kind of get a tester, to sort of say, okay, like actually this one is working pretty well. This is something I might want to run with for a little bit longer versus another one that you think I'm not seeing this one really working quite as well. So that's the first exercise. The second exercise has to do with keywords. This is, I think, really helpful for making connections between your experiences and what you want to share with schools, kind of thematically what you want readers to take away. So I would like to ask you all to participate here. Tell me, in the chat, you can raise a hand, whatever. What are the skills and personal attributes that a physician, a dentist, a healthcare professional should have in your estimation? Yeah, Jordan.
It's like communication.
Communication skills are so key. Amazing. Other thoughts?
I was gonna say confidence.
Confidence, yes. In many respects. Other thoughts?
Critical thinking.
Critical thinking, definitely, definitely.
Open-minded.
Open-mindedness. I see we also have empathy, personable, compassion, and humility in the chat. These are all great. Yes, absolutely. So these are definitely all characteristics. You can each individually think for yourself about, okay, what actually is important to me? What do I connect to? Which of my values really are connected to my professional ambitions? And so once you've made a list, then you can start to think about, how those values connect with your previous experiences. So I'm going to show you an example. Basically, what you do is you think about, which of the skills or attributes on your list really speak to you, really are things that you feel like your application can embody. And then you connect it to a significant experience, that you listed previously or that you're thinking of at this moment. And then you think about additional skills or attributes that you gained from that same experience and see how many connections you can make. So this is an example. In the rectangles are experiences, things that maybe a person would have done during college or after. In the ovals are competencies. So these come from the AAMC's core competencies for entering medical students. And these are all things that I think, largely we have covered in generating our list as well. And so what you can see from, connecting all of these things is that not every experience is necessarily connected to absolutely every one of the values or competencies, but by doing something like this, you can start to see which activities, which experiences tend to have the most action around those connections. Sorry, there's in the chat. Is everyone seeing the presentation now? Okay. All right. Also, if anybody is experiencing difficulties, I will share the slides, the individual, the PowerPoint and the recording of this presentation with everybody shortly. Okay, anyway, back to the map. So I think this is actually a really good way to think about how you can present your experience from the perspective of what you have gained from those experiences, what those experiences can say about you, about your readiness for entering your profession of choice, et cetera, through making connections to the different kinds of competencies, qualities that you think are important in the profession. When you make a map like this, look for anything that jumps out at you. Look for activities where you see the most connections and look for unexpected connections, things that you never thought about before that maybe you could express further in a personal statement or in other elements of your application. And speaking of that, the next thing that I want to talk about is a little bit about how to think about the different opportunities that you're going to have in your application to share information with admissions committees and where you might think about putting different kinds of information. So it's really important as you're, preparing for these processes to think about what you want admissions committees to know about you and to be aware of the different opportunities you're going to have to communicate with committees and to think about, which places are the best to share particular pieces of information. So I'm going to talk to you about 4 different kind of potential places that you might communicate with schools: the personal statement, your work and activities or experiences section, a secondary application, which is true for basically all medical schools, not so many dental schools, but we'll talk about it for the med applicants among us. And then, of course, interviews. It's my argument here that different sections of the application should not be doing the same thing, but they should be working in concert to complement one another. So for the personal statement, as we talked about, this is an opportunity to present a little bit of a narrative and to consider the question, of who you are or how you want to be perceived by admissions committees. A personal statement really prioritizes your perspective, your reflection, rather than information. So a personal statement is not a place where you necessarily need to be providing terribly specific info about exactly what you contributed, holistically to a particular endeavor. It's much more about kind of creating a vibe for the application. Now, the work and activity section, the experiences section, by contrast, is very much information focused. So that's the place where you really want to make sure you are presenting everything that could be relevant within the space that you have, and providing activity-specific details and accomplishments, right? So here you're thinking about, having an entry maybe for your thesis research. You want to think about, okay, how can I succinctly describe the research and the outcomes of the research? How can I describe what I contributed to it? And how can I, highlight potentially any particular competencies, any skills that I feel are relevant for the admissions committee to understand that I've gained based on this work. Secondary applications are, always a little bit unpredictable because the questions do differ from school to school. Although you will see that there are lots of overlaps. Many schools use some version of similar questions. And the thing about secondary applications is that there are opportunities to provide additional context relevant to that specific program. So in your personal statement and your experiences, you're being as general as possible because those are going to go to all schools. A secondary application is maybe where, you write about an experience that is in other parts of your application, but you include some details that might be particularly relevant for that individual program. Maybe it's a program that you did that is, kind of related to their institution in some way. Maybe the experience is a way that you can help to illustrate your connection to like some piece of the mission statement for that school, et cetera, et cetera. And so the secondary application is really not typically about introducing terribly new information, but rather building on information introduced elsewhere and kind of putting a fine point on it for each individual school to say, hey, this is something you individually, you should pay attention to about me. And then finally, interviews, which are, standard for many, many health professions. These are opportunities for schools to evaluate your communication skills, your ability to present, interpersonally, rather than information gathering. So in an interview, you should never feel pressure to be introducing brand new info. You may have stuff, obviously you'll have things going on as your application is proceeding. But the goal here is much more about understanding the person behind the application and getting a sense of, how you might function as a member of that school's community. So with all that in mind, when you're writing a personal statement, you want to think about a few things with all of these other opportunities to share information in mind. First, think about whether or how well any particular piece of information is going to fit in your essay. Is it something that can contribute to a narrative, or does it feel like something distracting? What information do you share elsewhere, right? So like I said before, it's pretty common for an experience that is listed in a work and activities or experiences section, maybe to be referred to in a personal statement, but you're not going to be using the same language. You're not going to be sharing the exact same information, right? You may be, kind of more reflecting on it rather than describing your contribution to the experience. And so you want to make sure that if you are talking about similar topics or themes across the different pieces of the application, that you're giving the reader something different in each of those spaces. And then, of course, you want to think about how well the writing represents your voice and your perspective. Does it sound like you to you? Does it sound like you to someone that you know really well and trust to say, hey, this piece of writing, yeah, I could see this written by you, right? And I also want to say, I think it can be really hard writing these personal statements because there are sometimes really important things that folks want to include, but just don't fit in the space that's provided. And I want you all to remember that nobody thinks that just because something isn't in your personal statement, it doesn't mean that it isn't important, right? Nobody is imagining that a personal statement could encapsulate everything that you think is important about you and about your professional goals. And admissions committees are going to be looking for details about your activities in the experiences section to learn more about you in the same way that they are learning from your personal statement, right? They're going to be considering all of these pieces. They're not prioritizing necessarily one over the other. It's very important to think about the context that you need to make any particular piece of writing work. So for example, either in a personal statement or in a work and activity section, if you're writing about the experience, you want to make sure that your writing conveys why you're telling a medical school or dental school admissions committee about this experience, because the experience can't have impact unless the reader really understands why it was important for you. It also can take a few tries to get the language that feels right, Um, a lot of times you're going to write a bunch and need to cut a bunch of details. You really, kind of have to think to yourself, what is the minimum level of detail that I need for this to make sense? You may really not have room for much else. It's also often the case that people sort of tend to start at least their writing in kind of a linear fashion, or presenting things chronologically, and that may not be the most effective way to do it in writing. The thing about writing is that it's independent of time. We are able to decide the order that we present things, and how we talk about them. And so you may find, if you start writing kind of from a linear perspective, that you end up reordering things, or or positionally highlighting various other things. It's also really important to know that, just because it takes a little while to get the language right doesn't mean that, you're doing something wrong, or that, it's a sort of wasteful process, because the more you think about actually how you want to express yourself, and the more you practice that at this stage, the better prepared you're going to be in the future when it comes to developing spoken answers for your interviews, and of course, writing the other pieces of your application. All right, so I want to end with a few tips, and then I'll open it up for questions. First things first, I know a lot of people are really concerned with their personal statement, like standing out among the pack. I will say that, in my opinion, the absolute best way for your personal statement to stand out is that it be very well written and very clearly expressive of your individual perspective. Unique experiences are not always a way to make a unique personal statement, right? So first of all, writing about an experience just because it, you think it is sort of statistically unusual is, I mean, you could do that, but you can't assume that you're the only person for whom that thing is true, right? Admissions officers are seeing thousands of applications, so there may be other people in the pool who have had relatively similar experiences. And that's always the case, right? This is the nature of these applications. These schools are asking you to have some research experience, some clinical experience, some service, right? These kind of standard contours are very similar for everybody. But that doesn't mean that your application has to look like every other application, because nobody else has had your experiences from your perspective. So for me, uniqueness or standoutness in an application process is much more about you clearly getting what's in your head onto the digital paper. And being able to clearly describe the impact your experiences have had on you and the development of your professional goals is much more important than those experiences being like wildly atypical. It's also important to try as best you can to avoid cliches in your writing. One of the things that I like to encourage people to do is to go through a draft and highlight every sentence that could have been written by somebody else. And this is often a place where you find, oh, there's a lot here maybe that doesn't seem as deeply tailored to me as it possibly could be. It can really feel difficult to write something that feels, very uniquely from your perspective, because on the surface, a lot of people share overlapping motivations to enter these professions. I very much hope that everyone here wants to help other people, that everyone here is interested in the application of sciences for the good of humanity. I mean, these are things that everyone should have, right? But if you're thinking about the personal statement in a much more refined way about expressing something really, sort of close to you and your heart, it's a lot easier to be writing individual sentences that don't sound like things everyone else could possibly say. And remembering that, your goal here is to highlight what you think is most important for readers to know about you. That's all you can do within the space of a personal statement, right? It's never going to be like the comprehensive full picture. It's important to try to show things through your personal statement rather than, simply to tell. Avoiding blanket statements, thinking about the claims that you're making and what evidence you have to support them is definitely important. It's also important to think about how your specific experiences and perspective have shaped your goals, maybe how they've developed over time, how you've grown as a person through your pursuit of a professional pathway. And it's good to let your experiences speak for you, right? So the example here is that you could say that you care about underserved populations, or you could talk about an experience that illustrates that you want to work with people who have had a tough time in life, one way or another, right? So volunteering with an organization that addresses homelessness, poverty, recidivism, that encapsulates, right? That entails that you're interested in working with at least one underserved population. As you're writing, you do not need to jam in the fanciest words you can find. Please, please make your writing sound polished but natural. An ostentatious word or two, and I hate the fact that I use the word ostentatious there in this presentation, but it's the only word I could think of. It can be really distracting. Like if somebody is reading and trying to follow along and trying to get to know you, and then you kind of like throw in an unusual word, it can be very like it can shake the person out of the mood you're trying to create. So just keep in mind that your writing should present you as a professional person, not a super stuffy one. If you are writing about maybe your research or experiences in clinical settings, do try to minimize the level of like jargon or abbreviations that you use, keeping in mind that number one, not all of your readers are going to be physicians. There are plenty of admissions personnel who are, people like me who are social scientists by training, and don't have clinical professional backgrounds. There are, of course, differences between the jargon of various subspecialties. So, your reader may not know much at all about the area of interest that you have. So make sure that your writing is accessible to all readers in that way. You should always read and revise for tone. Ask a trusted friend or two to read and tell you how it sounds. Does it sound like you? Does it sound approachable? Does it sound like someone who is curious and eager to be trained at the professional level? If you're writing about negative experiences, which does happen sometimes, and those experiences, frankly, can be very strong motivators for people to, go into a system and try to make it better. And I think that's wonderful. If you're writing about a negative experience, I think it's best, if you at all can, to present it from a positive perspective, right? So rather than focusing on the negative, stating the facts that you need to state, and then talking about how that's related to your desire to make a positive change. There's a difference between describing a problem and complaining about a problem, right? And so you could describe a problem and then talk about how you want to address that problem without it coming off, as complainative. And of course, remember that you're at the beginning of your career. You have a lot to learn. And so coming across as humble and eager to do that learning is definitely, a goal for everyone in this process. If you are writing about patients, which is not uncommon and very much fine to do, you can use a non-identifiable pseudonym. You could, Ms. R, you can use initials, you can make up initials. As long as you're not using the real patient information, it's fine. And you don't have to say, parentheses, I'm using a pseudonym here, especially if it's something completely unidentifiable, like initials. You should, when you're writing about patients, share only the details that you need to make your point. So, you don't need extensive details about the person's condition if your story is not really about their condition, if it's more about like an individual connection that you had. It may just be that you need to say this person was an inpatient in a hospital where you volunteered, right? You don't have to include much more. Or it could be, that you had a conversation with them about food insecurity. And so that's, the detail that you tell, but you're not, sort of talking extensively about their diagnosis, why they were in the hospital, et cetera. Do be very mindful of the adjectives that you use when you're writing about patients. Really, really do your best to avoid any words that could even have the appearance of being condescending or judgmental. And I think using these experiences in your writing is important to do from the perspective of a learner. So when you're presenting these experiences, it should be done from a perspective of acknowledging what you learned rather than what you did for the person. Similarly, if you're writing about your own medical history, which absolutely comes up for lots of people and is very much related to many people's interest in health professions. Again, do not give any more detail than you need to make the point. And think very carefully about how much you want admissions committees to know about your health history. That's protected information. It's not information that they would otherwise have access to. And, the world is not perfect. People can make judgments. So if you are considering writing about your own medical history, you are very welcome to chat with me about that decision and, to try it a couple of different ways and see what feels best for you. But it's definitely something that I encourage folks to do with discretion. Take your time in writing. You need to start early so that you can work gradually and give yourself breaks. Taking it through several rounds of writing and revision is important. And that process is really the point here. I know that you're going to send these statements to these schools and the schools are going to read them and they're going to decide if they're interested in them. But what you can take out of this is this process. What you can take away from writing a personal statement is, wow, I have actually had the space and the focus to evaluate why I am where I am and why I want to go where I want to go. I think it's also really important to be open to exploring new ideas. Trying multiple approaches is so key because, again, you can't evaluate a piece of writing until it's written. You can't just evaluate an idea on its own for one of these things. You may have to let go of language that you have used to tell your story for a very long time because it just doesn't work in the written format. That is incredibly hard to do. I think we all get very used to telling our stories with particular words. And that may just not be the best way to do it for the personal statement. So really try to critically evaluate that. As you try these new ideas, as you try new ways of expressing yourself, you might end up somewhere really great, even if it is unexpected. Okay. Last things to note is that I'll be continuing these writing workshops over the rest of the spring semester. So on February 10th, we're going to do a session on revising. So there, again, we'll talk a little bit about some different exercises you can use, and we will talk about different tips that I have for, once you've got a draft, what do you do with it? Which can seem a little bit daunting. And then in late March, after spring break, we'll talk about the experiences section, the work and activity section, and how you can best construct your list of experiences and descriptions of those in a way that will complement your personal statement. And that's it for me. So I want to open it up for questions. You are welcome to raise a hand or just start talking or to put questions in the chat. I feel it is impossible that I have answered all of your questions. No question too big or small.
Hi, I have a question. It's sort of related to, well, it is related to the committee letter. So I don't know if that's too specific of a question to ask now, like the committee letter application.
Sure.
Yeah, so my question was, how different is, I know you're only expected to have a draft of the personal statement, but how different should the personal statement draft be to the second like essay about like your interest in healthcare and like your healthcare like motivations?
Mm-hmm. Yeah, this is a super common question. It's okay if there's overlap. The goal of you doing the committee application is that you consider the specific questions and the reflection statements, and that helps you start generating some writing. And if you want to use any of that writing, from any of the essays, although I think the second one definitely has the most direct applicability, that's absolutely fine. So we will not be sharing any of the material that you submit to us in the committee application to medical schools. Nothing that you write is coming from us to medical schools.
Yeah.
The
Okay.
only things that they are going to consider are the personal statement and the activity descriptions and the secondary responses that you submit to them. So really, the goal is that the committee application is like an experimental place, right? It's a place where you can write about a bunch of different things, think about a bunch of different things, and then take what you like most from that writing and adapt it into a personal statement.
Okay. Got it. Thank you. That was helpful.
Yeah. It's my dark secret that I am making you all do this writing for your own good.
I guess I just have a kind of a follow-up with regards to those essay questions. I was speaking to one of the professors and he said that it's for the most part more informal than you think. And just with regards to the essays, like I think I was thinking a lot about it with like crafting it just like the personal statement. Like you want it to be a narrative, but how informal or informal like
For the reflection essays, because they're very specific questions, I think,
yes.
you should just answer the question, right? You should take the
Okay.
space that you need to answer the question, but you don't have to treat each of those questions as if that's your personal statement, right? So it doesn't have to be necessarily structured exactly the way that you would structure a personal statement. It should be complete. It should be well written, it should be free of errors and things like that and easy to follow. But it doesn't necessarily have to be framed as like, I'm going to tell you a story about this thing.
Okay. I wanted to confirm because I was like, I don't know
Yeah.
if I need to
We're,
like write
we're
stuff.
much more interested in
Okay.
information, that's really like, we're trying to get to know people by asking each of you these specific questions.
Awesome. Thank you.
Yeah. Other questions?
Is including aspects of faith okay for any of the questions for like the committee application and or like application in like secondaries, or I'm not sure where it would come up, but
Yeah, absolutely. Plenty of people do. I mean, plenty of people say in their experiences section might list their engagement with religiously affiliated organizations. A lot. I've worked with a lot of students who have done that in the past. Religion is a protected category, so it's illegal for people to make decisions about you based on religion, of course. But it's also, I think, everyone's kind of personal choice. For some people, their religious upbringing and the values that are associated with that can be very deeply tied to their interest in a profession in healthcare. For other people, their religion is something maybe that they don't want to talk about so much in this context, and so they may choose not to include that. I think it's very fair to do either, depending on what works best for you. But I have not noticed that it like creates problems for candidates who do, share information about their religious background.
okay, thank you.
Yeah. Any other questions for now? If not, we can break early. I'll be around, so if other questions do come up, please feel free to send me an email or to schedule a time to talk if you've got a bunch of them that you want to talk through. I'll be available to talk through, drafts of personal statements, things like that. So as you're working, if you want to, to work with me as you're developing your writing, you are very, very welcome to reach out. We'll also have some hours with writing fellows, specifically to evaluate things like how well your language is expressing your thoughts, how well structured the writing is, less so about like, is this appropriate for a medical school or dental school application, which is much more my job. But we will have hours with the writing fellows set aside for both current students and graduates to provide some feedback on just like structure and effectiveness of writing. And Maya, you have a question?
Yeah, sorry, just want to ask a last minute question. Will we have time to reflect with you after we submit our committee application and kind of go through it with you? I don't know, maybe you provide advice where you're like, in the future, if you were in an interview, I wouldn't answer the question like that in the way that you responded here or something like that.
Yeah, sure. I mean, you can schedule time to talk about your submission. I don't usually do like written feedback on committee essays because you're not going to actually have to submit those essays to anyone but me. But definitely I work with folks on like, we can look through the list of experiences and the descriptions that you've created for the committee application. And I can kind of, give you my thoughts about things that might be important to change or emphasize for the professional school application. Absolutely. My busy season is spring and summer. So come on down, schedule a time to talk and we can talk through anything that interests you.
Okay, great. Thanks so much.
Absolutely. All right. Well, as usual, I'm going to share the recording and the slides of this presentation with everyone within the next couple of business days. I hope everyone stays safe and warm wherever you are, and I look forward to working with you through the process. Remember, the first deadline is next Wednesday. Do try to submit as early as you can. Don't wait until the last minute. There could be technical issues, and we don't want that to happen. If there are technical issues, don't just go to bed and we'll deal with it the next day. Okay. But we all look forward to seeing everyone's submissions. I'll be in touch early in February about interview scheduling. So that'll be your next step after submitting your application. Have a great evening, everyone. Stay well, stay safe. I'll see you soon.
Thank you.
Thank you.
Thank you.